Hello, I'm Dr. Kuyunov. I'm here at Dental Prosthodontics of Rochester. We get a lot of questions about dental implants. So today I'm going to answer some of the most common questions on this topic to give you a better understanding of dental implants. What are dental implants? Dental implants are artificial anchorage devices. These almost the way to think about it is almost like a screw that being screwed into the jawbone. It's not really a screw, but it's a metal post that goes inside the bone and it stays there. It's it's made out of a medical grade titanium for the most part, titanium alloy, and it's all FDA approved. When it goes into the jawbone will fuse with it over time, and then it's going to replace what was before known as the root of the tooth. Now you will have a dental implant. It's not the tooth itself yet, it's just the part that is inside the bone where the original root of the tooth was. It's almost like when you think about a tree, you see the tree, but you do not see the roots of the tree. The roots are inside the ground. So whatever is inside the ground is considered to be a dental implant. On this dental implant, we then build a tooth structure or teeth or whatever goes on top. What conditions would cause a dentist to recommend a dental implant? Usually when the tooth is fractured and needs to come out, or loss of tooth for whatever reason. When this happens, there will be a missing space in the mouth because the tooth was lost. At that point, a dentist may recommend a dental implant if you are the right candidate for it. And a dental implant will replace the missing part of the tooth, the root, for that missing tooth. Also, when there are multiple missing teeth, a dentist can also recommend dental implants when it's multiple missing teeth, and then build a prosthesis over those implants. The prosthesis can be a dental bridge over implants, it can be a denture over implants, or it can be a full arch denture over implants that is removable like a snap-in, or it can be a full arch fixed denture that stays over the implant and cannot be removed. What are the advantages of dental implants? The advantages of dental implants is that they provide fixed type of solution that is within your bone. When I say fixed type, is that those dental implants are not being removed, they are staying there. If it's a replacement of a single missing tooth, it can represent or give a representation very close to natural of the tooth that was once there. If it's not a dental implant, there are other options. Most of those options require either to be a removable prosthesis like a partial denture, or a dental bridge that sits on adjacent teeth, but then it will require to shape the other teeth in order to make a bridge. The advantages of dental implants for somebody who has no teeth at all is that it can provide stabilization of whatever prosthesis a person will get. If it is a denture with an implant is usually more secured than without the implants. If it is a full arch fixed denture, that will provide a fixed full arch prosthesis that replaces all of the teeth in one jaw with dental implants, and it comes to mimic the nature very close or as close as possible when the teeth are missing. What is the process that you will go through if you decide to get a dental implant? The process is really usually 3 steps. Step number 1 is a review of your medical history and finding out whether you are medically fit to get a dental implants. Then, if this is okay, there is a dental exam, and you will go through a dental exam to verify that you actually a good candidate for dental implant from a dental point of view. And after medical history and dental exam, a doctor will make a treatment plan, and based on the treatment plan, you will be offered a type of dental implant and a dental restoration. I want to speak a little bit about the medical history. The medical history is important because not everybody is a good candidate, and sometimes a person can be a good candidate if he is healthy, he's not smoking, he does not have any medical conditions that will contraindicate surgeries or implant placement, such as medical conditions can be uncontrolled diabetes type 2, with high sugars in blood and hemoglobin A1C being high than for healthy people, this will decrease the chances of good dental implant outcome, or some autoimmune diseases, or other conditions that may decrease success of implants. So the medical history will cover all of those to make sure that you are a good candidate with a good long-term outcome for dental implants. I want to speak a little bit about the dental exam. The dental exam includes the health of your other teeth. Sometimes if one missing tooth requires a dental implant to restore one missing tooth, as long as other teeth are healthy, this will be a good solution. However, if a lot of teeth around it are not healthy and are not doing well, and there are cavities that are not under control, we want to first bring you to a dental health where you are free of cavities, where you are free of gum disease, such as periodontal disease, and free of other dental problems. Why? Because if you do have other dental problems, replacing a missing tooth with a single implant is almost a waste of resources, uh, of your resources, because if other teeth are going to fail and not do well soon, then we are looking to replace other teeth subsequently. A better way of doing it is doing a thorough dental exam and finding out, do you have other teeth that need to be addressed before we do the dental implant? Do you need multiple dental implants? Or what? Maybe you do not need the dental implants. Maybe today you just need a different type of prosthesis, and we just wait until you are at a place to have the dental implant made. So let's cover the dental exam portion. And I would like to come with the treatment plan, which we touched a little bit with the dental exam. The treatment plan should be done as a comprehensive treatment plan, not just replacing one tooth, but seeing the overall structure of your teeth and your bites and how things come together. Uh, it really requires to take the whole picture and think about the general aspects of your mouth, not just a single tooth, but what happens around this one missing tooth. What caused the tooth to break? Sometimes the causes that lead a person to break a tooth will be the same causes that will lead you to break the crown that is over the implant. So we want to make sure that if we restore you with implant and the crown or whatever prosthesis, we want to make sure that that's a good treatment for you and that it will last long term. So what are the steps in the process of placing a dental implant? So there are different scenarios for dental implants. Let's speak about a single tooth. If the tooth needs to come out because there is decay or it's fractured at the gum level or some other reason, then the step number one is, after we did all the medical exam and treatment plan, is to remove the tooth and place. At times it will require a preparation with a graft material where the graft is placed in order to keep the bone volume not decrease but remain the way it is, or even increase in volume, in order to prepare the future bone to have the proper volume and strength to get the implant successfully into it. So after the healing time of a few months, when the tooth was extracted and the graft material was placed, then we check. It has to be checked for proper volume to see if it is ready for an implant. Sometimes it is not ready for the implant because there is just not enough bone, and then bone has to be added to increase the volume of your current bone. This is called bone graft procedure. Once this is done, if it is necessary, then there is another waiting time of a few months to wait until the new bone will fuse with your jawbone and will give the volume that is needed for the implant. When this is done and everything is okay, then you are ready for the dental implant placement. The placement of dental implant is really guided by your future tooth. Where the future tooth is, that really guides the angulation and the depth and the exact position of the dental implant. So it's being called restoratively guided approach for dental implants. Where the tooth is, that's where, based on this, we decide where the implant goes. If it goes 3 millimeters under the gums or 5 millimeters under the gums, if it has to be placed slightly to the right or slightly to the left, a little bit more forward or backward, That's all being decided based on your future tooth. Nowadays, most of it is being done digitally. So right before we decide that implant is the right treatment for you, there will be an image taken. It's called a cone beam CT. It's a dental CT scan that allows us to see the volume of your bone. Also, an intraoral scan will be taken that takes really a picture of your mouth, a photographic picture. Now, both of these are being then fused. The photographic picture and the cone beam CT are being fused, and then digitally a new tube is being generated. All on the computer. We place the tube where it belongs. Now that we know where the tube belongs, we can plan your future implant where it has to be. Having this information in mind, the doctor is then ready to place the implant. Or it can even be that having all this information in mind, the doctor can generate a special guide. It's called a surgical guide for implant placement. And having this guide, using a guided surgery for implant placement, that really brings into extremely accurate results of implant placement. Once the dental implant is placed, there is a waiting time of a few months, sometimes 2, sometimes 3 months, sometimes even longer, to see that the natural bone has fused with the dental implant. And once the fusion happens, it grows together. Once the fusion happens and the dental implant is fixed in the bone, then it's the time that we can actually use this dental implant to place a tube over it. What goes over the implant is the abutment, and what goes over the abutment is the crown. I'm going to illustrate it. You can see the roots of the teeth, the roots of the teeth. This is the implant. This is the implant. All right. What goes over the implant is the abutment. All right. The abutment is the connection between the implant and the future crown, and it's actually like this is being done in the mouth as well, but smaller. And then over the abutment, a tube is being placed. And now this is ready. This is ready for you to be used. Okay, so it has 3 parts: the implant, the abutment, and the tooth itself, which is the dental crown. Once the process is being done and you have your tooth over the implant, things are good. Now it's time to make sure that this implant and tooth will survive many, many years. And the way to do proper oral hygiene at home, as will be described by your dentist, brushing and flossing is the same as for the teeth, and also to see your dentist at regular intervals. For some people, it's every 6 months. For others, it's every 4 or 3 months, to make sure that nothing happens around the implant, that the gums are healthy, and to keep them healthy. The health of your gums and of your adjacent teeth around the implant site will provide you with long-term success of this implant. When would bone grafting be required? If there is not enough bone volume for implant placement, a dentist will recommend to graft the area, add some artificial bone to add volume, and then after a healing period of a few months, your natural bone will grow into the space of the artificial bone and will create natural bone volume. And as long as this volume is thick enough, that will provide the proper dimensions for your future implant. When choosing your new artificial teeth, what options do you have, and what are the pros and cons of each option? Okay, this is a very good question. Artificial teeth can be 2 categories. They can be either fixed or removable. A fixed option stays in place. You cannot remove it. It's attached. Let's say it's a crown. It goes in. It's fixed. You cannot remove it. It stays there. That's a fixed option. A removable option is a denture. A denture that has attachments. And if this is the jawbone, it goes in and it clicks, and now it's attached. But it is a removable option. Okay, you can have a full arch fixed. Okay, that's a full arch, few implants, usually 4, 5, or 6, and you have a bridge that goes on top. Oh, bridge that goes on top, and it stays, and it's a fixed option. It's a fixed bridge. You cannot remove it. It stays. it screws in over the implants. Each one has pros and cons. Some people prefer a removable denture. They want to be able to take it in and out and clean because they are used to removable dentures from before, and that's what they want to have. So then a removable option is a good option. Okay. Sometimes a patient wants a fixed option, but there is no more space for implants. A patient can only have 2 or 3 implants, and with 2 or 3 implants, you can only do a removable option. You cannot do a fixed option. The beauty of the fixed option is that it's fixed. You don't have to remove it. It stays there. It stays there, and it will act as natural teeth, or as close as possible to natural teeth, because it is fixed and not removable. I don't have many negative things to say about the fixed option. I think it's a top option to think about and consider. It is more expensive than the removal option in general. It really gives high levels of satisfactions to people when they have a fixed option and they do not have to worry about taking it in and out in order to clean it. Or some people, they go to different places, nursing homes and hospitals, and dentures can be lost. With the fixed option, it's not being lost. It's always there. In addition, it doesn't feel like you're aging when you have fixed prosthesis in the mouth. It keeps the young feeling, or younger feeling, than before. Patients have different feelings about the fixed and removable. For the most part nowadays, patients do choose the fixed option over the removable, and it's increasing with time. More and more people want a fixed option than the removable. Nothing is wrong with the removable. If this is the only option available for you, that's still better than having no teeth. How long does it typically take to recover from dental implants? The recovery period is really about a few weeks, just like after tooth extraction. The surgical part is done, and patient goes home, and the recovery period is really the first few weeks, 1, 2, 3 weeks, and then the site heals. However, waiting for the implant to fuse with the natural bone in your body, that will take the next 2 to 3 months, sometimes even longer if grafting was involved during dental implant placement. Waiting 4 months and sometimes even 6 months is not unusual and has been seen in dental practices. On average, waiting between 2 and 3 months for most people, this is the time that is needed to have the implant fully integrated with the jawbone. How long do dental implants last? Dental implants should last many years. It's difficult to place a number. At the beginning, when they just came to dental practice, we did not know anything. We thought 5 years, 10 years, 15 years, 20 years. Now we see people with implants after 20 years, and those implants are doing well. Um, we don't really have 100 years follow-up with implants, but most people do not need 100 years follow-up. Anywhere, if it's over 5 years, it's a good success rate. And if a patient is going to do proper oral hygiene at home and have all the follow-up visits with the dentist for hygiene, then implants should last more than 5-10 years, 15-20 years and over it. If there is any gum inflammation around the implants or starting of a disease, if it's being caught early and being treated early, there should not be any problems with the implants. So to answer these questions in conclusion, implants should really last a lifetime. However, sometimes they are not, and when they are not, it's usually a problem with either the body rejecting it, which is unusual, or some disease happening around the implant, which was not caught either by a patient or by a dentist. Can dental implants get cavities? No, dental implants cannot get cavities because it's titanium alloy, and bacteria does not create cavities on it. However, dental implants are being fused with the bone, and the gums is growing over them. Bacteria can still lodge within the implant and the gums, and with time, if this bacteria is not being cleaned by oral hygiene at home or the dental professional hygiene in office, These bacteria can then cause bone loss around the implant. It's not cavities, but it's called a gum disease. It's called peri-implant disease, peri-implant mucositis, peri-implantitis. It has different names. It's the same as for natural teeth. Some people have bone loss on natural teeth, not cavities. And the bone loss is being caused by bacteria as well. So even though dental implants cannot have cavities, they can still have bone loss. Therefore, proper oral hygiene is very important. What are the costs and financing options involved with dental implants? The cost for dental implants is a high-end treatment. It will be within dental treatment. It will be probably the highest cost of any other treatment that you will have, of any other options in dental treatment that you will have. There are different financing options available if the patient cannot afford paying for the dental implants, or dental insurance that the patient has does not cover fully dental implants, which is usually is the case. So financing options are available, and they will vary from individual to individual, depending on the credit score, depending on multiple factors. This has to be checked individually, and if you would like to have uh, uh, more answers about this, you will have to inquire about it in person. Do most insurance plans cover the cost of dental implants? I don't think so. I do not know how many of them do cover dental implants. Some of them partially cover dental implants or surgeries associated with dental implants. But the full cost of dental implants from start to finish with dental crowns will not usual to see it covered fully by dental insurance. How can you schedule an appointment to talk to a dentist about the dental implants? The best way of doing it is calling the dental office, calling your dentist, or calling us if we are your dentist, and schedule the appointment in person to get a medical history reviewed, to get your dental exam, and a treatment plan in place. Once all these three steps are done, if you are the right candidate, this will be discussed with you, and you will get all answers that are tailored for you, for your situation, and for your health and your body. If anything else will need it for you to provide for you, it will be all discussed at the appointment when you come here. So the best way to get information is to come in person and inquire in person. I hope I was able to answer some of your most common questions about dental implants. If you have any additional questions, or if you're ready to take action, please call us. Call our office, Dental Prosthodontics of Rochester. Our phone number is 585 471 5689. We are here to help. Thank you. I hope I was able to answer some of your most common questions about the dental implants. If, however, you have more questions, you are more than welcome to come and contact our office to get an appointment in person. Our phone number here is 585 471 5689. We are here to help. Thank you.